The southwest town of Leader is struggling to understand what went wrong with a piece of equipment at their hospital. On Tuesday, members from the Cypress Health Region informed the community that equipment used to sterilize medical instruments at the hospital may have been malfunctioning. CEO for the Cypress Health Region, Jim Hornell.
I'd like to stress that the equipment in question may well have been sterile, but we're unable to confirm, and as a result we've moved to take measures to ensure that the equipment was not in use, and also that we would accelerate how we would be processing all sterile equipment within the entire Cypress Health region.
The machine is known as an autoclave. It uses heat and steam to clean medical instruments, and it appears that the autoclave was not working properly between January 1st and August 13th of this year. During this time, 169 patients had minor surgical procedures at the outpatient department in Leader. Medical Health Officer Dr. Kamishikani says the region has contacted all but 28 of those patients, recommending blood screening for hepatitis B, hepatitis C, and HIV.
If there is anybody who may have had some procedure in this time period, please do not hesitate to get in touch with your family physician or to get in touch with our public health office.
Dr. Shikani stresses the risk of contacting an illness is low because of the types of procedures that are involved in Leader. Minor treatments like sutures or removing staples, cysts, and moles. Beyond contacting the affected patients, the Cypress Health Region canceled surgical procedures in Leader for several days. They removed all minor surgical and medical instruments from the facility and sent them to Swift Current at the regional hospital's specialized sterile processing department.
Several of the facilities already were having them processed at the new regional hospital, and we've accelerated that process now and said as of now all will come through the central processing at the hospital.
To get a sense of how the community is reacting to this news, we met up with Gary Meyer, town councillor for Leader and former mayor. He says he wasn't aware of this situation until the media reports started coming in.
I guess I'm a little disappointed that there was an invitation sent to the council in general to attend the press conference to see the details of the whole problem at the hospital.
However, the Cypress Health Region did in fact contact at least one town official. We reached Leader Mayor Craig Tondevold by phone and says the Health Region called him before the weekend.
The director of the health district brought me up to speed on Friday that they had found this out, and we're doing an investigation as to why this occurred and when it occurred, and I'm just waiting to find out through the investigation as to what happened there.
Meanwhile, Jim Hornell says the investigation is already underway.
We have identified this as a critical incident, and as such we'll be working through an investigation to see how this happened and to get to the bottom of it so that we can make a report.
And since this is a critical incident, the Health Region is obligated to finish its report to Saskatchewan Health within 60 days. For Southwest TV News, I'm Joey Donnelly.